Hello, my name's Alison Brown. I'm Principal Educational Psychologist at St Helens, and I'm going to tell you a little bit about what educational psychologists are and then how we contribute to the Education and Healthcare Needs Assessment. So educational psychologists have a degree in psychology. We've usually had some experience working with children and young people, usually in educational settings, and then we've done further study at postgraduate level to apply psychology to education. And this means that we're qualified as educational psychologists. We're registered with the Healthcare Professional Council, the EHCP, and we work with children 0 to 25. We follow our professional guidance and also the SEND Code of Practice. So we contribute an assessment to all education healthcare needs assessments. We're asked for our psychological advice. Our psychological advice is based on an assessment of children's strengths and needs as learners in school. So that means we usually visit schools or settings or wherever the children are for their education to find out a little bit more about them. We usually base our assessments on consultations with staff in those educational settings, nurseries, schools, colleges, consultations with parents and carers because we're really interested in the child holistically wherever they are, consultations with the child or young person, so we meet with them to find out about their views about school, their interests, their aspirations for the future, and we often work with children and young people to collect a little bit more information about how they learn and what helps them learn. This helps us to get a picture of the child and young person as a learner in wherever they go for their education. So it helps us think about what helps them learn, what support they might need, what they like and what they hope to do in the future. And we put this together as a psychological formulation, and that's based on all the information. So what parents and carers have said, what staff in school have said, but most importantly what children and young people have said, and the information we've collected from the tools that we use. We're really keen on getting and representing the views of children and young people, and we use lots of different tools and techniques to do that. So we might talk to them and ask them questions, we might ask follow-up questions, we might ask them to scale, to give a number from 1 to 10 about how important things are for them. We might use card sorts, we might ask them to draw pictures about their ideal school or their ideal future. So we tailor that to the individual child or young person to get the most out of them and help them to engage and access what we're doing. We need informed consent to become involved. So usually this is given by parents and carers when the request for the Education and Healthcare Needs Assessment is made. But when we meet with children and young people, we also ask them for their consent or assent. So it's really important that we ask the people that we work with, the adults that we contact, to share information about our role and what we're going to do so that children know what to expect before they work with us or they meet with us, and they know a little bit about us beforehand. So that's an overview of what we do around the Education and Healthcare Needs Assessment. We're always happy to answer any questions about our involvement. So if you know we're going to be involved, please do contact us and ask us. We're happy to talk about what we're going to do. Thanks so much.